Pelvic health clinicians are trained to assess muscles, fascia, joints, and maybe sometimes organs. But one powerful system influencing pelvic function is often overlooked, and that's the lymphatic system. In today's episode, I speak with a pelvic health therapist and certified lymphedema specialist, Ellen Kramp, about how lymphatic congestion in the abdomen and pelvis may contribute to symptoms clinicians see every day. Listen in to today's episode to hear how pregnancy and postpartum changes and C-section scars can affect lymphatic flow and what to start looking for with your assessments. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody, and welcome to this podcast episode. Today, I'm excited to introduce you to my guest, Ellen Kramp. She is a physical therapist, a certified lymphedema specialist. She practices out in Washington, D.C., and she is also an amazing educator. So welcome to the podcast, Ellen. Thanks for being
Thank
here.
you. Thank you,
Yeah.
Lynn.
You know what? A student of mine was saying, "Have you met Ellen Kramp? You need to, you guys teach so similarly." And I was just like, great. And I think we emailed each other and then we actually ran into each other at a course together. And that
Yes.
was so fun to finally go, oh my gosh, you're you. And we needed to meet. So absolutely loved meeting you in person at that course, Ellen. And then we decided I needed to have you on my podcast because I love the topic that you're teaching. And that is that not many of us, especially as pelvic health therapists, this area that you're teaching on that we're going to be talking one area today, which is the lymphatics, is not really in our awareness, not on our radar. So tell me, how did you get involved in this? And then what do we need to know about the lymphatic system as a pelvic health therapist?
All righty. So many moons ago, I had decided when I was taking continuing ed classes that I wanted to look at things systematically. So I took a craniosacral class. I did a myofascial release class. I did a visceral class. And I'm like, okay, what other systems? Lymphatic systems. So I did a lymph drainage class. And then I ended up going through and getting the full lymphedema certification, which is, I think it was 140 hours worth
Wow.
of coursework and education. It's a lot. And I remember back in PT school, all we learned was, oh, if the patient has lymphedema, you do a retrograde massage and you throw on a Jobst pump.
Right.
And,
Yes.
you
Yes.
know, there I covered what we just covered in PT school.
Yeah, right.
And so
Okay,
there's a,
so wait a minute. You and I are advanced in our experience, let's put it that way. So we were in PT school quite a while ago. Has that changed? Are they talking any more about lymph in PT schools? Are you even aware of that? Like
I
newer
had,
therapists are listening in. I'm curious what you guys know.
yeah, I've asked a couple of newer therapists. I've asked, a couple online back in the listserv days.
Oh.
Ooh, there was there. Oh my gosh, I opened a can of worm when they were talking about what should we have the APTA tell therapists regarding lymphedema?
Yeah.
And my response was, see, refer them to a certified lymphedema therapist. And ooh, yeah, there were a couple of people in that listserv who were teaching their own weekend courses
Oh,
and we're just like, oh no, we are qualified as PTs to treat that. And I'm like, after I did my certification, I disagree. I
yeah.
disagree because I mean, how many of you listening out there even understand what the lymphatic
Yeah.
system is and how in depth you can like make it into 140 hours. It's
Yeah.
not like okay, yes, I was bored through some of it, but you know, but for a lot of it, we did like a 5 day long intensive on learning how to bandage. And oh my gosh, that I was never bored for a second during
Wow.
that 5 day long course where we were, I mean, serious 8 hours a day, you know, learning all the different techniques and the um, different types of equipment. And gosh, it is really super complex. And you have the normal lymphatic system, and then you have the abnormal lymphatic system. And was the abnormal lymphatic system something that this person was born with, or was the abnormal lymphatic system surgical? And
Okay.
so, working, we'll focus here on the normal lymphatic system for the most part. But yeah, it's very different when you start talking surgery and anatomical deviations. So I
All
can.
right. So tell us, what do we need to know about the lymph system
Okay, so let's talk about it in a
in a
nutshell.
nutshell?
In a nutshell, all right. You have the arteries that are bringing the blood out to the cells. We all know that. The
Yep.
veins are bringing the blood back. However, they're only bringing back about 90% of what those arteries brought out. In your cells, they get their nutrition, they're doing their job. The cells are leaking out fluid, they're leaking out waste products all the time. So they're doing their thing and they're sending the waste, any excess water out of the cell. The lymphatic system is picking up that extra waste. It's picking up the extra fluid. So, your body wants to maintain this nice, even blood pressure for the most part. So, if you have a lot sitting in between the cells that suddenly get back into the venous circulation, your blood pressure is suddenly going to be up. So the lymphatic system also helps to maintain that blood pressure balance too by not allowing so much into circulation. So if you think about as well, your body also doesn't want to deal with a whole lot of bacteria and waste products and viruses and such. So if you cut your hand, um, that's now open and you're bleeding. And okay, so how's the body going to deal with that? Because you just introduced a bunch of bacteria into your system there. Well, hopefully most of it didn't get into the venous system, but into the lymphatic system. So the lymphatic system's going to pick that stuff up, and it's going to pick up the any proteins that are too large to just diffuse into the venous capillaries. And that's going to travel along in through the lymphatic system right alongside the venous system. So they are running parallel. The difference is the lymphatic system, you have lymph nodes. So that's going to travel typically to the lymph nodes in the armpit from your hand.
Yeah.
Lymph nodes are full of white blood cells. And within those white blood cells, they are going to deal with any bacteria that got
Mhm.
trapped into that wound and picked up by that lymphatic system. So it's going to clean it up. It's going to clean up anything that your circulation does not want to have in it. So it's going to deal with all of that through those lymph nodes. And then it's going to, once it's cleaned up, send it along further. And it rejoins the circulatory system somewhere either along the internal jugular, along the subclavian, the brachiocephalic vein, shortly before it dumps back into the heart. So the heart gets 100% of what it sent out, but the venous system is only picking up that 90%. So the lymphatic system is dealing with that other 10%. And I mean, I did that in a nutshell, and I know I didn't get that much in PT school.
Yes, that is true. That is true. Yes.
It's kind of like the lymphatic system exists.
Right. So the lymphatic is really in that interstitial tissue, right? Because it's not a
That's the
vessel.
beginning of it.
It's yeah,
Right,
it's not a blood vessel, it's not an artery, and so but it's alongside of that. And
right.
then the lymph nodules help clean up what's in the lymph, right?
Right. There are lymph vessels. So in the interstitium, that's where it starts. There are um, lymphatic capillaries. So you have like these lymphatic junctions that as the swelling happens,
Mm-hmm.
the junctions open. And then because of the osmotic pressure, it ends up going into the lymphatic system. And you have slightly larger and larger and larger lymphatic vessels as things travel along.
Okay.
So the lymphatic vessels are present in every tissue of the body except within the eye itself and within the brain itself. However, within the eye, you do have the aqueous and vitreous humor. So you kind of have a specialized lymphatic system there.
Yeah.
And then in the brain, you have the cerebrospinal fluid. So again, you pretty much have a
Wow.
specialized lymphatic fluid there, but it within the brain, they found that it rejoins like the cervical uh, lymphatic circulation. And it's so it connects the cerebrospinal fluid connects in with the lymphatic circulation within the neck. So
Wow.
it's really
Yeah.
interesting.
Oh, the body's amazing, and that's why we love what we do because we're so intrigued by it. So tell us about the lymphatic system in the pelvic space.
So in the pelvic space, it's again right next to everything. So, um, anywhere you have arteries and veins, you have lymph. So if you remember from PT school, navel, nerves, arteries, veins, lymph. Those four travel together. So you have lymphatic
Yeah.
vessels traveling right next to those veins. And that within the pelvis, you're going to have like the iliac arteries and veins coming in. The internal iliac arteries feed the pelvic organs, and they are going to have the iliac veins draining the internal pelvic organs, and the lymphatic vessels also draining those side by side. So if there's congestion in the lymphatic system, either from lymph nodes within the gut, because the entire gut has to drain to those lymph nodes.
Yeah.
Um, and there's a huge portion of the lymph nodes that are involved with digestion. So, for those of us that do a lot of digestive stuff with our patients, the visceral snobs in the group, um, there is a lot of lymphatics that the body is dealing with, and there's like almost a specialized system. The lymph within the abdomen is actually milky white. It has a different term. It's called chyli. So um, the chyli is or chyle, depending on who you talk to, it's going to pronounce it. That is milky white within the gut because it has a lot more fat in
Mm.
it, and throughout the rest, it's more clearish. I mean, if you've ever worked in ICU and you've seen those patients who are just like really, really, really third spacing and super swollen, and then they start seeping, they're
Yeah.
seeping lymph at that
Okay.
point. So,
Wow.
yeah. Yeah, so it's more clear in the extremities and it's more
Yeah.
milky white in higher fat content. There's, I don't know how many people have favorite researchers, but I'm that nerdy that I have my favorite researchers. So there's a woman, Laura Santambrogio, who she had presented at the NIH at a lymphatic conference that I had attended, and she actually tested the composition of the lymph before a lymph node and after a lymph node, and in different situations within the body when there is inflammation, when it was like within the gut, when it was, and she has like this basically proteome of what it consisted of pre and post lymph in pre and post node. I'm like, oh my God, that is just so cool. And how that lymph node changes the composition of the lymph before and after.
Wow. How cool. How cool.
Yes.
So what does this mean for, like, how do you know when you're working with someone, it's like, oh, I need to work on their lymph system?
When they think of, okay, we've all treated total knee patients. So
Yes,
think of your total knee
hopefully.
patient. Yeah. You know, there's basic PT school,
Right, right. Yeah.
and you remember that thick, heavy, boggy knee and
Hmm.
how that felt afterwards. Well, there's a lot of lymph just kind of sitting there.
Yeah.
So the body's trying to deal with that surgery and everything that was going on there. You've got a ton of inflammation going on. There was stuff that was introduced there. The immune system's trying to deal with that. And so there's a lot that the lymphatic system needs to pick up. So it's that thick, boggy kind of feeling that's there. You can have that same feeling within the gut, that abdomen that you're trying to get in and palpate stuff, but you're almost being pushed off
Mm.
because it's so kind of thick and boggy. That's usually excess lymph within the belly. So draining the deep lymphatics all of a sudden, and, we talked about how we've talked in the past about how quick changes can happen in the postpartum
Yes. Yeah.
woman and how we love working with this population. Well,
Yes.
the lymphatics are just as fast, if not faster. It's
Yeah.
so awesome to see how quickly, when you've had congestion in nodes and it's just not draining well, how quickly that can go down. So your patient that's just bloated,
Mm.
yeah, they might have SIBO, but they
Yeah.
also might just have some congestion in lymphatics. So those that just are chronically bloated, those often have a lot of congestion in the lymph nodes that are deep in the abdomen. Um, those that have just heavy periods, like really heavy periods, a lot of discomfort. The uterus just feels too big.
Mm-hmm.
It feels boggy, dense. That's often lymphatic congestion. The bladder can feel that way as well. The colon can feel that way. Like I said, generally within the abdomen, it can feel that way. Sometimes you need to drain the abdomen for that uterus to be able to drain, or for that bladder to be able to drain. Sometimes the urge and stress incontinence can be because that uterus is so heavy or because there's so much excess fluid putting so much pressure on that bladder. So, because that bladder can't fill the way it needs to, and it's getting that signal that I'm full like way too soon, um, those you end up with those frequency patients or those patients that just have just too much there. They can't compensate. And so they're leaking or just going frequently
Yeah.
or urgently.
So what are so the swelling, the bogginess is that our biggest signal? Like I there's a client that I'm thinking about. I'm like, oh my gosh, her uterus felt huge in there.
Right,
Um,
right.
and I was just doing some mobilization and doing what I do, and it felt like it like shrunk back down to a more
Hmm.
normal size, and over a couple of sessions, it's now got much better mobility. But how would I know that it's not just the uterine restriction versus lymph as the issue?
With these patients, well, for me, I just go in and I assess, I drain the deep lymphatics. I see how that's going. I also have to it's another episode, but working with the venous system as well, because again, that's carrying 90%.
Yeah.
So if I work with the venous system, if there's congestion in through there, I need to open that up. And if that's open, I check the lymph nodes within the deep abdomen, and I check the lymph nodes or the lymph vessels and drain the uterus itself. If it drains really well, or I'm not finding any issues, that might be something like adenomyosis.
Yeah.
Or, what else might be going on that's causing, does she have massive fibroids? Does she, what's going on that might be creating that big heavy uterus?
Yeah.
Is it, to me, that's something it's like, okay, can I drain this and make this feel better and she feels better? Good. I don't need to refer her to OBGYN.
Yeah.
But if I can't get things mobile and soft and the way they should be feeling, just with doing some visceral stuff and lymphatic work, then those are the ones that it's like, yeah, go back. You need some imaging done. Phew,
Okay.
off my table.
When you're doing the lymphatics, like abdomen obviously is done externally, but when you're talking about the pelvic space,
No,
are
I do that externally as well.
okay, okay. So
Yeah.
so it's all done externally. We don't
Yes,
need to
all done.
do the lymph
No,
internally. Okay.
no, no.
Okay. Interesting. So what about pregnancy and postpartum? How does the lymph system get affected by that?
Well, you have this huge pregnant belly.
Mhm.
That
Yeah.
can sometimes it's compressing the venous system, and that's the problem. Um, because you have your patients that have those vulvar varicosities
Yeah.
or just, sometimes it's just the swollen vulva, and it may be just on one side. So, is there some compression on some lymphatic vessels? Is there compression on the vein? Is there compression on some of the lymph nodes? Did she maybe have like an ingrown hair that, caused this one lymph node that happens to be draining like a similar area? Is that congested that we can just drain and boom, the rest of the area then just softens and drains. So there could be many different things. You also have the patients that tend to hold a lot of fluid in their
Yes.
legs
Yes.
and they can tend to be really swollen. Well, it can be lymphatic if they have just kind of crappy venous circulation, crappy venous return. Venous stasis can turn into lymphedema on the road because the lymphatic system, it's only supposed to be dealing with 10%. And when you're asking it to deal with 40, 50%, it's kind of like, I can't, there's just too much. So it just can't do all of that. And
Yeah.
yeah, it's trying to do all of that and it just can't keep up. So wearing compression stockings in those cases can be helpful. Getting, uh, educating the mom to, okay, maybe it's time to not lay on your back or sit so much and,
Okay.
walk
Yeah.
a little bit more and, get on all fours and, you know, get the pressure off those posterior
Vessels.
vessels.
Yeah.
So, you're not always compressing the iliac vessels or the inguinal vessels or, the femoral vessels, depending on how much the baby belly is sitting on. But, opening things up and getting pressure off so that vessels have more space. So lymph can drain, the venous system can drain. So
Okay.
that's what we're working on with them because sometimes the swelling can be okay, they're not eating enough protein or something else is going on. I mean, if you talk to an acupuncturist, they have their whole list of
Yeah.
things that
Yeah.
they want to deal with somebody who's retaining fluid. Or might it be preeclampsia? So is that something that, take their blood pressure, see if there's something else going on? Do you need to refer back to OB? So there are like many different reasons why those legs could be swelling. You don't want to miss like, oh, well, it's lymphatics now. I just learned about lymphatics
Right.
and just look at it from that perspective when it could be preeclampsia and okay, oh crap, her blood pressure's 160 over 95.
Yeah.
Yeah, OB.
Yeah.
I think we got a problem.
Yeah.
So yeah, so if the blood pressure's fine and you're having her do her things with getting pressure off of the blood vessels. So she's on all fours or just letting her belly hang off and on throughout the day to allow the posterior circulation to be happening, to allow the lymphatics to be draining better. Getting her legs up in the evening. If she's in a spot where she's sitting, can't she have her legs elevated to help support the return circulation? Laying on the side versus on the back. So there are like many things that we can suggest, um, increasing protein intake, that sort of thing. But if they're doing all of that, still having swelling, refer to acupuncture because there are a lot of things that they can do as well, assuming that the blood pressure is under control.
Right.
And then you don't have to refer back to OB. But yeah,
Um,
there are many things there.
so when you talked about those varicosities
Hmm.
and varicosities on one side,
Right.
how do we differentiate that, is it lymph? Is it the vessels? Is it pressure? It's probably all the above, but is there a way for us to determine what might be truly causing that varicosity?
Well, if there's a varicosity, there's a boatload of pressure on the venous system. And the venous system, if there's pressure on that, I mean, for those that do diagnostic ultrasound, so if you
Mhm.
do ultrasound in your office and you go to look at an artery in a vein, you can see the artery bouncing on the screen like this. And the vein just goes the vein compresses. And fun fact, the way, if they're checking for a DVT in a leg, the way they know it's a DVT is that vein does not compress. So the veins tend to be easily compressible. So if there's compression on a vein that's and it's staying compressed, but you have blood still trying to go through there, first that vein is going to expand. And when it can't expand anymore, it's then going to elongate. And that's how you end up with a varicosity. And
Okay.
you have valves that have failed at
Hmm.
that point because they can't even get together. So they had been in a space like this and they had been touching like this, but now the walls are out here, and no matter what,
They're not,
these
the
they
valves
they
are
that
not
the valves
touching.
can't
Yeah.
touch anymore. So that's an area that's failed. You can't magically make a varicosity back to where it was again. That vein has that ship sailed.
Okay.
That vein is now no longer, but that is venous compression that caused that. Where that compression happened, it depends. Is it happening under the inguinal ligament? Is it happening more superficially? Do they have some fascial restriction that was
Mhm.
preventing that? Do they have a scar that held that vein down? Do they just have, is there a muscle? What? Don't know until you have your hands on the person
Right.
where that compression started.
So I know I've only heard, and I've never taken a lymph course, so I want to come
Mhm.
take your courses, Mary Ellen, because Mary Ellen teaches a lymphatic and vessel course for pelvic health therapists. And so please check that out if you guys are interested in that, because I think it is important for us to know that all these structures are a possibility for
Right.
us. And, I say if you're a pelvic health therapist and you're only addressing the muscles of the pelvic floor internally, you're missing half of the system. And so, we need to expand our horizons, everybody. We need to know how to make effective change in the organs, the vessels, the lymph, all of it together, because that's what's in the body. That's what's between the pubic bone and the sacrum, front to back, and everywhere in between. And so, I love that you have chosen to do this. Why did you create this course? Like, how did you get into teaching and creating a course?
I had actually asked, I took my courses through Bruno Chickley.
Okay.
And one thing I love about him is he teaches how to feel the lymph in the body. So he was originally under the Upledger Institute
Yeah.
umbrella of different practitioners.
Yeah.
And, Upledger, Baral, Chickley were all together at that point in time when I had started. And um, Bruno had developed his courses and had a lymphedema certification at that point. And I'm like, okay, you really need to develop a course for um, pelvic practitioners because as pelvic PTs, they don't want to go through lymph one, lymph two, lymph three to even get to the point where you're teaching where, lymph within the pelvis.
Right.
So that's 4 3-day long courses that they have to go through to get to the pelvis where they're actually going to be treating. And it's like, can we, kind
Yeah.
of pare this down and streamline this and do one? And he's like, well, do you think we can get, I want to say he wanted like minimum 30 people for a course. I'm like, back in
Yeah.
2005, when I was asking him, we had what, 100 pelvic PTs? It's like,
Yeah, not
they're
many, but
just
yeah.
there were not many of us back over 20 years ago. And so I decided, okay, well, if he's not going to do it, I'll take it on
Yeah.
and I'll do a course teaching lymphatic. And I he had taught one vascular class, but it was like for the face and the heart,
Okay.
that he taught. And I thought it was rather fascinating. And I'm like, okay, this is practice changing. I love the vascular stuff.
Yeah.
And so I just took kind of what he taught and extrapolated it out,
Hmm.
to the pelvis itself. So,
Awesome.
um, so that's
Of
that's how I ended up with the combined course.
course on it.
And
Yeah.
yeah,
That's awesome. Well, okay, we need to wrap up quickly here, but not, we never really talked about postpartum. So the lymph system in postpartum, we still have the varicosities that might be an issue, but what
right.
else do we need to keep in mind in that postpartum period that might be lymph related that we might not be aware of?
Our C-section patients.
Ah,
You
yes.
you have, that C-section scar. Some people have a lot of swelling, especially around the mons.
Yeah.
Um, they aren't draining well into the inguinal ligaments, which are kind of where the hip fold is. They can be rather bloated through the abdomen itself,
Mm.
and just things not draining well, just with all the compression that was there through the pregnancy and all the organs sitting up and back. That can cause compression as well. So they can have like this low level bloat that just remains afterwards in the postpartum period. And the lower extremities too. Sometimes, especially if there's extra tension in the inguinal area or the iliac area, the legs can stay bloated for an extended
Mm.
period of time. And some women, it's not that common, but some women need just extra help with draining those legs.
Okay. All right. Cool. Well, thank you so much, Mary Ellen. Anything else that you want to let us know about that we should be aware of for lymph and uh, maybe share real quickly if you can, like you can't teach us how to treat it in 2 seconds on a podcast, but can you give us a little bit of the concept of treatment of the lymph system without
It's
going into details?
Yeah, it's really it's hands-on. A
Mhm.
lot of the lymphatic courses teach that it's just this epifascial. So you're above the layer, the muscular fascial layer, and I'm like, but you're missing out on like the deeper layers. So
Yeah,
deep abdomen, the organs, the muscles, they're missing out on a lot of that by teaching just that really, because you'll
superficial.
hear about dry brushing, you'll hear
Yes.
about that type of thing, and that's great if you've got some puffiness.
I was gonna say you're seeing a lot of that on Instagram for those brushes that people are doing to brush the lymph from the face.
Yeah, um, sure that helps, but
Yeah.
yeah, it's still, it's following the flow of the lymphatics and just working with the tissues and the lymph nodes until they drain appropriately.
Ah,
So, yeah, I mean, you'll
okay.
feel a difference. You'll feel like this through the tissue when it's like foggy. So
Yeah.
it's just kind of goes.
I love that sound. Do that again.
Oh, oh.
Guys, if you're listening to the podcast, you have to go to the YouTube channel and watch Mary Ellen do that on YouTube in video because it was quite entertaining.
But yeah, it's like this thickness
Yeah.
that gradually becomes thinner and lighter and then just
Okay.
flows. So
Starts
it's
flowing.
really cool.
Love it.
Yeah,
Love it.
it's
Okay.
really
Oh,
cool.
That sounds like something I could get addicted to.
Yeah. And it's like if you like really quick changes,
Yes.
lymphatics are great.
Awesome. 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 Well, everybody, I don't know, a student of mine who has taken both my course and Mary Ellen courses have said that we're very, very similar. So I encourage you to check out Mary Ellen's course and learn more about the lymph and the vessels. And we'll get her back on here at some point and we'll talk about the arteries and the veins in the pelvic health space and the importance of that as well. So hopefully, this podcast has widened your horizons about the lymph and really looking at that as a potential system that we can make effective change in for our clients. All right, cool. Mary Ellen, thank you so much for being here. Thanks for sharing your wonderful wisdom with us. And we'll look forward to part two when we get into the arteries and the veins next time,
All
the
right.
vessels next time. All right. All right. Thanks,
All right.
everybody, for listening in, and we will see you all in the next episode. Please share this with any colleagues that might be interested in understanding more about the body and the lymph system, and know that we can make effective change with that. And it's quick and fun, too, right?
Yeah. Yeah.
Awesome. Yeah. Great. Thanks, everybody. Take care. We'll see
Thank
y'all in the
you.
next episode. Bye bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.